Most people think a heart attack makes an entrance, a crushing pain in the chest, a dramatic collapse, a hand reaching for the left arm, a desperate call for help. That is what movies teach people to expect. But after 60, some of the most dangerous heart events do not arrive like that at all. They arrive quietly. They build in silence. They develop while the house is dark. They happen when the body is supposed to be recovering. And by the time anyone notices, the window to stop them may already be gone. A few years ago, a 71-year-old man was brought into emergency care after collapsing before sunrise. According to his wife, the evening before had looked completely ordinary. They had dinner late. He took one medication but forgot another. He snored heavily for most of the night. The bedroom was warm. He had barely had any water because he did not want to wake up to use the bathroom. There had been no panic, no dramatic warning. No reason, in their minds, to think this night would be different from any other. But inside his body, several small stresses were building on top of each other. And that is the part most people never hear until it is too late. I'm Dr. Adrian Keller, and today I want to show you 5 nighttime habits that quietly raise the risk of heart attack, stroke, dangerous blood pressure surges, and serious cardiac stress after 60. These habits do not look dramatic. That is exactly why they are dangerous, because people repeat them for years. Night after night, week after week, year after year, and the heart keeps paying the price in the dark. But I do not want to leave you with fear. I want to leave you with control, because once you understand what your heart needs at night, you can protect it with a handful of practical changes that cost little, take little time, and may matter far more than most people realize. So, stay with me. What I'm about to explain is not complicated, but for many people over 60, it may be life-changing. Before we go through the 5 habits, you need to understand one thing. Your heart does not rest at night in the way most people imagine. It does not stop working hard. It changes jobs. During healthy sleep, the cardiovascular system is supposed to enter a calmer mode. Blood pressure should dip. Heart rate should settle. Blood vessels should relax. The body uses those hours for repair, regulation, and quiet maintenance. That overnight dip matters. It is one of the reasons sleep is so protective when the body is functioning well. But after 60, that protective system becomes easier to disrupt. The arteries are often stiffer. The blood pressure response is less flexible. The body is less forgiving of dehydration. Sleep becomes more fragmented. Medication timing matters more. Breathing disturbances become more common. And the cardiovascular margin for error gets smaller. That is what many older adults never fully understand. At 35, your body can absorb mistakes more easily. A heavy late meal, a warm room, a little dehydration, a missed pill, a bad night of snoring. At 70, those same mistakes land differently. They hit a heart that has fewer reserves. They hit blood vessels that may already be narrowed. They hit a circulation system that no longer adjusts as quickly as it once did. And that is why the night can become dangerous. Not because nighttime itself is the problem, but because so many people unknowingly go into the night with the wrong setup. Let's start with the first habit. Habit number 1, eating too late and too heavy. I want you to think about what you usually eat in the evening, not what you eat on your best day, what you actually eat on an ordinary day. What time is dinner? How heavy is it? How close is it to bed? Because in adults over 60, one of the quietest nighttime heart stressors is a late, heavy evening meal. People underestimate this constantly. They think digestion is a stomach issue. It is not only a stomach issue. Digestion is also a circulation issue. When you eat a large meal, especially one high in refined carbohydrates, fried food, heavy fats, large portions, or rich sauces, your body has work to do. Blood flow is redirected toward digestion. Blood sugar rises, insulin rises, triglycerides rise. The heart may need to pump harder. Blood pressure may climb. Reflux risk increases. Sleep quality often worsens. Now picture that happening close to bedtime. Your body is trying to move into nighttime recovery mode, but instead, you have given it an emergency shift. The heart is not easing down. It is managing a large digestive workload while the rest of the body is trying to sleep. That conflict matters. And in people over 60, it matters more. Why? Because the older cardiovascular system does not adapt as gracefully. Late-night digestion can contribute to higher nighttime blood pressure, more reflux and chest discomfort, more sympathetic nervous system activity, worse sleep quality, more early morning cardiovascular stress. And if you already have arterial stiffness, blood sugar problems, hypertension, or coronary artery disease, this habit can quietly push the system in the wrong direction night after night. I have had many patients tell me, "Doctor, I barely eat all day, and then I have my main meal at night." That sounds normal to them. But from a cardiac point of view, it is often exactly the wrong pattern. The fix here is surprisingly simple. Try to finish your main dinner by around 6 or 7 in the evening whenever possible. And if you eat later, keep it lighter. Protein, vegetables, smaller portions, less grease, less sugar, less volume. Your evening meal should support sleep, not fight it. And if you are regularly lying down within 1 or 2 hours of a heavy dinner, I want you to take that seriously. Because many people do not realize that what they call normal evening eating may actually be creating the perfect setup for nighttime cardiac strain. Habit number 2, taking blood pressure medication at the wrong time, or forgetting it. This next one is one of the most important points in the entire video. If you are over 60 and you take blood pressure medication, do not assume the timing is a minor detail. For many older adults, it is not. It can be critical. Most people think of high blood pressure as a daytime problem. But after 60, one of the most dangerous patterns is elevated or unstable blood pressure during the night. Some people do not get the normal nighttime dip in blood pressure at all. Others get early morning surges, especially in the hours just before waking. That is when the heart and blood vessels can be especially vulnerable. Those early hours are not harmless. They are some of the most dangerous cardiovascular hours of the day. A vulnerable plaque can rupture. A clot can form. A stroke can begin. A dangerous pressure surge can hit stiffened arteries that no longer absorb stress the way they once did. Now here is the problem. If someone takes all their medication in the morning, and the effect begins to wear off by the late evening or early morning hours, they may be less protected exactly when they need it most. Or worse, they forget a dose entirely. That happens more often than people admit, especially if they feel fine. But feeling fine is not the same thing as being protected. This is why older adults need to talk to their doctor specifically about timing, not just about dosage. Some patients do better when at least part of their blood pressure regimen is taken in the evening. Not everyone, but many. And the point is this. If you are over 60 and no one has ever had a detailed conversation with you about whether your medication timing matches your blood pressure pattern, then that conversation may be overdue. Because blood pressure treatment is not just about getting a good number at 2 in the afternoon. It is about protecting the heart when the body is most exposed. Ask your doctor directly, should any of my blood pressure medication be taken later in the day or in the evening to better protect me overnight? That is a strong question. And if you are someone who occasionally forgets your blood pressure medication at night, stop treating that as harmless. Because when the body is older, even one missed window of protection can matter more than you think. Habit number 3, ignoring heavy snoring and possible sleep apnea. If there is one nighttime danger that gets laughed off far too often, it is this one: snoring. Many people still treat snoring as a joke, an annoyance, a family story, a reason to nudge your spouse, a sign of deep sleep. But in adults over 60, heavy snoring, especially snoring with pauses, choking sounds, gasping, morning headaches, dry mouth, or severe daytime fatigue, can be a serious cardiac warning sign. Because what may be happening is sleep apnea, and sleep apnea is not just a sleep issue. It is a cardiovascular stress disorder. Here is what happens. The airway collapses or partially closes during sleep. Breathing stops or becomes shallow. Oxygen levels fall. The brain senses danger and sends out a stress response. Adrenaline rises. Blood pressure spikes. Heart rate shifts. The person may partially wake without remembering it. Then it happens again and again and again. Sometimes dozens of times an hour. Think about what that means for the heart. The body is supposed to be resting. Instead, it is being shocked awake repeatedly. That repeated oxygen drop and stress surge creates a serious burden on the cardiovascular system. Over time, sleep apnea is linked to higher blood pressure, atrial fibrillation, stroke risk, heart attack risk, poor blood sugar control, worse sleep recovery, daytime fatigue, and brain fog. This is not a small issue. And older adults miss it constantly because the symptoms are often normalized. I'm tired because I'm older. I snore because everybody snores. I get up to urinate because that happens at my age. I wake with headaches sometimes. No big deal. Sometimes it is a big deal. If you are over 60 and any of these sound familiar, take them seriously. Loud, regular snoring, waking up choking or gasping dry mouth in the morning, Morning headaches unexplained, daytime exhaustion being told, you stop breathing in your sleep, frequent nighttime urination with poor rest. That pattern deserves evaluation. And if you have heart disease, high blood pressure, prior stroke, atrial fibrillation, or major fatigue, a sleep study is not some optional luxury. It is part of proper cardiac care. I know people resist treatment like CPAP because they do not like the idea of a machine. I understand that. But do not let discomfort with treatment blind you to the seriousness of the condition, because untreated sleep apnea can quietly pound the heart for years. One of the smartest things many seniors can do is stop dismissing snoring as just snoring. Sometimes it is the sound of a body under cardiovascular stress every single night. Habit number 4, going to bed dehydrated. Now we come to one of the most underestimated habits on this list. Evening dehydration. Many older adults deliberately cut back on water at night. And the reason makes sense. They do not want to wake up to use the bathroom. They do not want falls. They do not want broken sleep. They do not want disruption. I understand that completely. But when some people stop drinking too early or go to bed underhydrated, they create a different kind of problem. Because the heart and circulation system do not like dehydration. When you are even mildly dehydrated, blood volume changes, circulation becomes less efficient, the blood may become relatively more concentrated, the heart can work harder, blood pressure regulation may become less stable, and in a body already dealing with narrowed arteries, sluggish circulation, or nighttime vulnerability, that is not a trivial thing. During sleep, you are lying still for hours. Movement is reduced, the heart rate slows. The body is depending on a smooth, stable circulatory environment. If you add dehydration to that, you can tilt the situation in the wrong direction. Many people never connect this. They think water is about thirst. It is not only about thirst, it is also about circulation. And older adults tend to feel thirst less reliably than younger adults. That matters, because the body may need water before the person feels a strong desire to drink it. Now, I am not saying you should drink so much right before bed that you are up all night. That is not the goal. The goal is balance. But many older adults would benefit from making sure they are not entering the night already dry. A simple glass of water in the evening can be more protective than people realize. And keeping some water nearby during the night or first thing in the morning can also help. This becomes even more important in warm bedrooms, people taking diuretics, people with dry mouth, people who sweat easily at night, people who already limit fluids too aggressively. If you are over 60 and have been taught to fear nighttime water more than nighttime dehydration, I want you to rethink that, because for some hearts, dehydration is the bigger danger. Habit number 5, sleeping in the wrong environment. This final habit catches almost everyone off guard. Bedroom conditions, especially temperature. Most people think bedroom temperature is only about comfort. Hot, cold, blankets, preference. But your cardiovascular system notices the environment you sleep in much more than you may think. If the room is too warm, the body struggles to release heat properly. Sleep becomes less restorative. Heart rate may stay a bit higher. Sweating can increase fluid loss. Rest becomes shallower. The whole system stays a little more activated than it should. If the room is too cold, the body responds differently. Blood vessels tighten, blood pressure may rise. The heart has to work against more resistance. For older adults with stiff arteries, hypertension, or coronary disease, that matters. In other words, too warm can stress recovery. Too cold can stress circulation. The body sleeps best within a certain window. Not too hot, not too cold. For many people, a cooler but not cold room is ideal. Older adults often sleep in rooms that are too warm without realizing what it is doing to their sleep quality, hydration, and cardiovascular calm. And because poor sleep itself worsens blood pressure, inflammation, and overall cardiac resilience, the environment matters. Now add in one more factor: screens. Bright phones and tablets late at night keep the nervous system more alert, interfere with melatonin, and can push bedtime later while making sleep less efficient once it finally comes. This may sound far removed from a heart attack. It isn't, because the cardiovascular system depends on restorative sleep to reset properly. Bad sleep is not just about feeling tired. Bad sleep becomes a heart issue when it is chronic. So if your evening environment includes a warm room, bright screens, restless, fragmented sleep, dehydration, heavy dinners, snoring, then you are not just having bad nights. You may be creating a pattern that quietly raises cardiovascular risk. Now, let's put it all together. I do not want to leave you with 5 separate warnings and no clear plan. So here is the simple version. If you want to protect your heart at night after 60, build an evening routine that does the opposite of the danger pattern. That means 1. Eat earlier. Try to finish dinner by 6 or 7 when possible. 2. Make the late evening lighter. Less volume, less sugar, less grease, less strain. 3. Take blood pressure medication thoughtfully, not randomly, not forgetfully. Discuss timing with your doctor. 4. Take snoring seriously. If you snore heavily or feel exhausted despite sleep, do not ignore it. 5. Go into the night hydrated. Not flooded, hydrated. 6. Sleep in a supportive room. Cool enough, calm enough, dark enough, screen light reduced. These are not extreme changes. That is what makes them powerful. People think protection only comes from dramatic interventions. It doesn't always. Sometimes the heart is harmed by ordinary habits, and sometimes it is protected by ordinary corrections. Let me be blunt for a moment. After years of seeing damaged hearts up close, I can tell you this. A lot of people do not lose the night because of mystery. They lose the night because no one ever explained the setup. No one told them that dinner timing mattered, that hydration mattered, that snoring mattered, that bedroom conditions mattered, that blood pressure timing mattered, so they repeated the same routine every evening and thought it was harmless. That is why I care so much about this topic, because what looks ordinary at 9:30 p.m. may not be ordinary inside a 68-year-old cardiovascular system. And if no one tells people that, they will never know to change it. You know now. That matters. The heart-safe night routine. If I had to summarize all of this into one simple protective routine, it would sound like this. Eat dinner earlier. Keep the late evening calmer. Do not skip blood pressure medication. Do not ignore snoring. Drink enough water. Sleep in a supportive environment. That is it. That is not glamorous. That is not trendy. That is not some miracle health hack. It is simply what the older heart needs. And if you are over 60, that routine may matter far more than you think. Before we finish, I want to ask you something directly. Which of these 5 habits sounds most like you? Late heavy dinners, blood pressure medication, timing problems, snoring, or sleep apnea signs, avoiding water at night, sleeping in a room that is too warm or too cold? Tell me in the comments. And if you know someone over 60 who does 2 or 3 of these every night, send this video to them, because many people are not one dramatic symptom away from danger. They are one repeated habit away. I'm Dr. Adrian Keller. Take care of your heart tonight, not only tomorrow morning. Sleep well. Hydrate wisely. Protect your blood pressure. Respect your breathing. And stop treating nighttime habits like they do not count. Sometimes after 60, they count the most. This video is for educational purposes only and does not replace medical advice. Always speak with your doctor before making medication changes or acting on symptoms that may affect your health.